Assalamu alaikum. Welcome back to Hilaal Live. Thanks for joining us on channel 347. Also on our live stream, www.hilaal.tv. Now, often enough, we hear about projects that affect and assist our community, and we have amazing professionals that give back their time, give back their expertise to ensure that our communities are taken care of. Two such individuals are dentists based here in Cape Town. I'd like to introduce Dr. Farahnaz Parker first. Assalamu alaikum.
Walaikum salam. Thank you for having us.
My absolute pleasure. And then Dr. Rezia Salie. Assalamu alaikum.
Walaikum salam.
Shukran so much, young ladies, for coming in and speaking about, what you do for our community as well. But for those that don't know you so well, our audience is maybe speaking or hearing from you for the first time. Please maybe introduce yourself. Tell us a bit more about what you do.
Okay, well, thanks for calling us young ladies, firstly.
You're welcome.
I'm Dr. Farahnaz Parker. I'm a general dentist, and I have a passion in family dentistry.
Okay, wow.
Yeah.
And how long have you been doing this for?
Yeah, we've been doing it quite long, 15 years.
Wow, you guys look like you just stepped out of high school.
Thank you.
And yourself, Rezia?
So also a general dentist,
Okay.
and I do part-time teaching at the University of Western Cape. So enjoy the balance of being at public sector and in the private sector as well.
Right. But how did you guys team up? I mean, did you guys study together?
Yeah.
Or were you friends? How did this happen?
It's actually a very nice story. I met Dr. Salie at a karate class when we were 11 years old.
Right.
We've been best friends ever since.
Okay.
And we actually, funnily enough, we both have a severe dental phobia.
No.
So we've had
Needle
traumatic
phobia.
experience, needle and dental.
So who do you guys go to see to
I
you?
go to-
That's funny.
And
All
only
right.
trust.
Yeah.
But what inspired you to get into this industry? It's not
Yeah.
something that most people want to get into. Let's start with yourself, Farahnaz.
Well, I think, my favorite toy as a child was my doctor's kit. And I've known from day one I needed to be in the industry where I'm nurturing and healing. And it was actually Dr. Salie that wanted to be a dentist.
Okay.
I followed her along to a job shadow one day and
Okay.
I was blown away.
So
And I
you're the
knew-
team leader here.
So
Okay, what made you dentistry very unique, very different niche market? When people think, medicine, they would think going into maybe even a pharmacist or a doctor as well. But dentistry,
look, I always enjoyed working with my hands.
okay,
I never saw myself sitting in front of the PC or computer or anything.
okay.
And I enjoyed working with people, socializing, and I just,
Nice.
yeah.
I would imagine in your profession as well, your bedside manner is needs to
I
be,
think you have to have that personality.
I think so, right?
Yeah.
Because generally, and I'm speaking for myself here, I mean, it's traumatizing going to a dentist, and
Yeah.
I have a cousin that's a dentist, so I get the friends and family discount. But at the same time, it's traumatizing going
Yeah.
into a dentist, it's intrusive as well. So having
Yes.
that bedside manner is important.
So, yeah, I definitely think so. You have to have a lot of patience.
Yeah.
Yeah,
I think if anyone understands it, it's the two of us.
Okay.
We have that phobia. It's not something that you just outgrow. And I think if anything, it's been such a help within our profession because when that patient sits down, we know exactly what's going through their mind. We can see the anxiety.
Right.
So it's our mission status to make them comfortable, to give them the service that we would want to receive, and to actually just change the whole attitude towards dental care. It does not need to be a nightmare. It can be, well, we always say, you come to us for the spa experience. That's our goal.
I've got so many questions just after that comment. But going into the teaching side as well, is this what you do part-time?
so this is what, I do
okay.
it part-time on a Tuesday and a Thursday,
Okay,
and it's just chair-side teaching. So
Right.
it basically in minor oral surgery, so only extractions,
right.
and we teach them how to extract. So I enjoy teaching.
Has the
Yeah.
industry evolved from the time when you studied to where it is now?
So I think it definitely has.
Like
Yeah.
in terms of the equipment
Technology.
you use,
So technology has
yeah?
changed, definitely.
Is AI coming to play at all? Soon? Not yet?
Not yet.
Not yet. Okay.
But
all
there
right.
has been
getting
talks.
there.
There has
It's
been
getting
talks
there.
about it,
Okay.
but yeah.
It's
So-
easier.
So if you look at your industry, Rezia, let's start with you. I mean, we often know that we need to go to the dentist, we need to do certain things, but in your experience, why is dental health so important?
So as most people know, they need to brush twice a day. They floss daily. They need to see a dentist twice a year. But many of them don't understand why they're actually doing it, or they don't understand the importance of oral health. So they often only tend to see a dentist when they have pain,
Right.
or they see an obvious sign of a cavity.
Gotcha.
So I think good oral health is important.
Mm.
So we see it as, they often say that the condition of your mouth is like a window to your general health,
Okay.
and it ties in with your overall well-being.
I like that.
So if you're looking after your teeth and your gums, it can prevent serious diseases, or just reduces the risk of complications from a chronic illness. And I think just like improves your mental health. Or
Look, your
so
confidence.
yeah.
I would imagine, because often enough, people tend to lose confidence if they have, challenges with their teeth. But you guys have embarked on a very special project, and I think that's the reason I invited you guys in to speak about that. An-Noor Orphanage is a very close organization that's very close to our heart at Hilaal TV, and you guys have embarked on a project with them. Farahnaz, tell us about that.
Yeah, so basically, I think we both are very passionate about treating kids. We love working with our little patients. And we were raised in households where we watched our parents place a huge emphasis on just giving back to the community, which they still do.
Nice.
And it's really encouraged us. And I think what we realized is it's not just the act of giving and having someone receive, but us as the givers, we see it as this emotional upliftment, spiritual growth. So we are excited to have an opportunity to actually be able to give back. And so An-Noor, Dr. Salie's mom has worked with him, so she's sort of been a stepping stone for us.
Yeah.
And we've just been lucky enough to be in this position to help. So
Stunning. I like that.
Yeah.
Especially young professionals like yourselves that can be so instrumental for other people to follow suit as well.
Yeah.
What are some of the work that you do with An-Noor?
So currently we're seeing them for emergency treatment. So when they have pain, they often come, but we're hoping to expand that and then trying to at least give 2 or 3 hours just to do preventative treatment.
Oh, nice. Yeah.
So that's our plan long term to.
So is it just the boys or the
So
girls?
it's the boys and the girls.
And the girls as well. And I would imagine they must be fascinated by the industry.
when they're not scared.
Ouch.
After they turn.
After
Very
they calm
fascinated.
down.
Yes.
Okay. Do they ask you guys questions about the industry, or maybe a few of them would like to go into dentistry, perhaps?
I think when they come in, they're quite anxious.
Yeah.
So it's either like just get it over and done with.
But the girls, surprisingly enough, I've had a few questions from the girls. So, we are a female-run practice, and I think not realizing it, but there seems to be an attraction towards that, but just development of, women empowerment.
Yeah,
as well.
I think that's important.
Yeah.
It also creates an avenue that they haven't really necessarily explored.
Exactly.
This now gives them options.
To know what's possible, and
There we go.
anything's possible.
There we go. Was it important for young professionals like yourselves to give back to the community?
Well, we've both actually been in the public sector, and we can see that the stress that the government has trying to cater for the community. And what we realized is, if you can just start small, focus within your community, find out what institutes are close by, and even just the tiniest of steps. We've seen patients miss appointments, not having money to get to the faculty, arriving late and being turned away. It's a struggle to get there, and it's a struggle to actually get a place to be seen. So I think if other healthcare professionals can identify this need and play their part, it does take away from the stress on the government, but also it makes healthcare more accessible. And I think we've all taken that oath as a healthcare professional that we're there to serve, and that's exactly what we want to do.
Stunning. Well done. Well said. Rezia, in your humble opinion, what is your message to other professionals, maybe encouraging them to hop onto a project like this or other projects?
So as an independent practitioner, especially if you have your own practice, we could come together and decide on either a day or like one day in a month where they can all come on board, and we can do screening for, say, the boys or the girl orphanage. And then the more hands we have, the better it will be. So that's our long-term goal, to get everyone to just come on board. And then, we open to obviously opening up our practice for
support of this project.
Yeah.
I think it's brilliant. Congratulations. I think this is the start of bigger things to come, inshallah. Jazakallah so much for being part of our community, for being there to ensure that communities like and organizations like Anur have the professional support. So all the very best.
Thank you.
Very quickly, where are you guys located?
So
Address?
we are in the southern suburbs,
Yeah.
48 Old Strandfontein Road,
Right.
ProSmile Dental.
ProSmile
Yeah.
Dental. There we go. Thanks so much. Have a great
It's a
evening.
pleasure.
Assalamu
Thank
alaikum.
you.
Alaikum
Walaikum
salam.
salam.
So there we go. Two young professionals giving back their time, ensuring that our community is well taken care of. That's all that we have for you from the Cape Town team. Sohail Barnes, Mohammed Parker, and myself, Lukman Shadrack. Have a great evening. Assalamu alaikum.